Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us again for our weekly press conference on Delaware's response to COVID-19, our weekly update. I'm joined again by our team, Dr. Kyle Rattay, who's the Director of the Division of Public Health. Dr. Rattay, thank you for all the things your team is doing, just incredible work for such a long time now. We appreciate their resilience. We appreciate everything they've been through. We also have AJ Shaw, the director of our Delaware Emergency Management Agency, and Pam, our sign language expert for the deaf and hard of hearing. AJ reminds me this morning, I'd like to take a moment just to remember the 3 firefighters who were killed overnight, I guess, or yesterday in the fire in Baltimore City. We do have some Baltimore City firefighters who live here in Delaware. Our thoughts and prayers go out to their family members, to their colleagues at Baltimore City Fire Department. It's an incident that resembled in some ways, AJ, the tragedy we had outside the city of Wilmington just a few years ago, where we lost 3 firefighters in a similar collapse of the building. And we just know we appreciate so much our first responders, our firefighters who do that kind of work, where they're charging into burning buildings and while other people are running out. In this particular case, just to identify and find others that might have been sleeping in the building, not as residents, but just as shelter, and just hearts are heavy today. With that, before we go to data, I would just also like to thank our hospital workers who've just been amazing this past month. Just incredible surge of COVID patients, incredible surge of people needing emergency care in our hospitals. Many of their colleagues, which tested positive for COVID-19 and couldn't be on the job, which stressed them even more. We did send in now up to 160 or thereabouts guardsmen and women to do non-clinical duties, and I know they've been greeted with open arms by our hospital workers. We appreciate the guardsmen and women for their great work, their dedication, their selflessness through all this, and certainly our appreciation to the doctors, nurses, aides, food service folks, everybody in the hospitals who've been under the gun. You know, when we need hospital care, they're there to provide it, and we don't always need it, but God forbid that it wasn't there when we did need it. So our thanks for that service of our hospital workers, and thanks to our guardsmen and women. AJ is going to report more on their activities, and particularly as they have rushed into our nursing home facilities to provide additional hands there so that the hospitals can discharge patients and provide space for other patients who need that care. So let's go to the data. You'll notice that all the data is heading, the numbers are still very high in terms of new cases there, over 1,600 on the 7-day moving average. Those new positive cases, though, were up over 3,000 a day on the 7-day moving average, and so down 40% or thereabouts. The percent positive, we got up to just above 30%, now down to just below 24% on the 7-day moving average. So both of those numbers, they go in combination because testing varies from day to day, and AJ will report later that our testing numbers again are off the charts. They've slowed down a little bit, but still 50,000 or so last week, and which is a really big number. Importantly, the number of people hospitalized for or with COVID-19 is down to 550. The total peak on January 12th, the same day as our peak last year, was 759. So we're down from 759 to 550, headed in the right directions. It's slowed down a little bit the last couple of days. So we expect now, as AJ will report, as we send in the CNA trained National Guardsmen and women to provide relief for our long-term care facilities, will enable the hospitals to release more patients who don't need hospital care to the long-term care facilities. And so we're expecting and hoping that number of 550 will be reduced again over the next weeks. Those CNA trained guardsmen and women arrived early this week. So we expect to see some results there. And sadly, still Delawareans who are passing from COVID-19. That number continues to tick up, although slower than it has in the past. And so let's look at the hospitalization number. That's the roller coaster ride. I mentioned the peak at 759 on January the 12th of this year. January 12th of last year was the peak, last winter peak at 474. So we're keeping an eye on 474 as we go ahead, because we know last year at 474 and with reduced populations, for other conditions in the hospitals were in a pretty good place. So that'll be a benchmark for us. We're down to 550 now as of January 24th. The low point, of course, in the summer, let's look for brighter days ahead, was at 14, and we hope to get to there at some point in the future. Let's look at the total hospital census. You can see those numbers are still up because in the gray there, still a lot of Delawareans in the hospital for other things than COVID-19. The dark blue those are the numbers for COVID-19 patients with or for COVID treatment. And so still very high census there. And we'll be looking at that number as well to guide our activity with the Guards, men and women. Next slide shows the vaccine numbers, still very strong. Over 1.6 million vaccines administered, 66% of Delawareans fully vaccinated. That includes the little ones that aren't eligible yet. You can see the numbers there for those eligible, 5 and over, almost 70%, running all the way through to those 65 and over, 93%, almost 94%. We still need to get those eligible boosted. We know that if you are boosted, the chance of being hospitalized go down significantly, and so we're keeping an eye on that. Over the last couple of weeks, you'll know our focus has been on ramping up testing with the testing demand for tests surge that we saw after the holidays, the New Year's holidays, Christmas and New Year's holidays. And you can see over the last week or so, we're down to 7,000 a day on a 7-day moving average. That's still 50,000 a week, so it's still a big number there. To 200,000 or so a month. And we did get additional assistance from FEMA for a drive-through event out at the DMV, Delaware City, which was a big help, took some relief off. AJ will have, or I guess I'll have more on that. Here you go on the next slide. There's the COVID-19 drive-through testing site at Delaware City DMV, thanks to de.gov for allowing us to use that facility, thanks to the de.gov employees, thanks to the other volunteers and others that were doing the vaccinations, thanks to FEMA for heading that up for us. We really appreciate it. We do still have that in line there, weekday hours in the evenings from 5:30 to 9:30. You can see already we've tested over 2,200 at the Delaware City DMV, again, taking some of the pressure off other venues for getting tested, which was very helpful. The last day of DMV testing, unless things tick up a little bit, which we don't expect, we expect things to continue to go down in terms of demand there. The last day will be Sunday, January 30th. So keep that, mark that on your calendar. Next is a reminder that we do have a mask mandate for indoor public settings in effect. I want to thank all Delawareans as I travel around in and out of convenience stores, my Wawa, grocery stores, gyms, restaurants, bars, all these places that are indoor venues where there's a risk of transmission of COVID, the Omicron virus, one to another. Please wear a mask. I've noticed that folks have really put their mask back on. I know you don't want to do it, but you're thinking about maybe the two physicians that we had on a couple of weeks ago. They had some very heartfelt stories about the situation in the hospitals. When I talk to employers here in our state, the one thing that they mention first right off the top is that they have so many employees who've tested positive, can't come to work, and it's really affecting negatively their businesses. I met with the Restaurant Association members at their quarterly meeting just last week, similar reports in terms of the challenges that they face. So we can help them by wearing our mask in public places, stamping down that winter surge that we're seeing. Everything's moving in the right direction. Let's just keep those masks on. We don't want them to have a mask mandate a day longer than necessary, and we'll keep our eye on the data to inform that decision making. We are distributing over 125,000 KN95 masks to students 6th grade and above because they're the larger masks, and educators and child care providers. These are at designated delivery sites or distribution sites at schools and child cares to go and help with keeping our children back in school for in-person instruction. We know that I was in a school today and all the kids had their masks on. Everybody was really very disciplined about that, had a good interaction with teachers and staff at Harlan Elementary. So hats go off to Harlan and your teachers and staff for really doing a good job. You can get at-home tests, rapid tests through the federal government, which is distributing 4 at-home COVID-19 tests per household. You just you can order them online at covidtest.gov. That's covidtest.gov. You can see it up there on the slide, or call 800-232-0233, or you can get these COVID tests at Delaware libraries. I don't think the tests have arrived yet. I know a number of people who've signed up already and registered to get tests, but the test is in the mail, so to speak, and tests are on the way to our libraries where you'll be able to get them as well, and we'll have further information on that, I'm sure, in the weeks ahead. One of the challenges that we have, Dr. Rattay emphasizes that each and every week, is how important it is for those eligible to get your booster shot. I've had my booster shot. 90% improves to 90% the protection against ending up with a serious illness that would put you in the hospital. That's really important. And so everybody get the muscles there on the slide there, and get your COVID-19 booster. All right, thank you very much again. Thanks go out to our frontline hospital workers, nurses, physicians, food service, maintenance, you name it, everybody at the hospitals, and our National Guardsmen and women who've been deployed, 160 plus for their non-clinical functions, those that have been trained up as CNAs to help to take the pressure off the hospitals. And it looks like hopefully we're over the hump here. We need to all continue to pull together, wear our masks indoors, drive this spread down, and get into a better place this spring. So with that, I'm going to turn it over to Dr. Carol Rattay, the Director of the Division of Public Health. Dr. Rattay.
Thanks so much, Governor. I share in your cautious optimism. It's great to see some of our numbers improving. As I reflect on where we are today, I think it is important to remember that there is still a lot of COVID circulating in our state. And while our numbers are improving, our case and hospital rates are still much higher than they were this time last year. People keep asking me, when do we think we can treat COVID like the flu? And in addition to our high hospital rates, I was thinking about our death rates in the last few days, which I think are a stark reminder that COVID is not just the common cold or even the flu. Prior to Thanksgiving, we shared on a press briefing the sad news that we had lost 2,200 Delawareans to COVID. And since that time, we've lost nearly an additional 300 Delawareans. And when you compare that to our worst flu season in history, where we lost 36 Delawareans, it's clear that we're just not yet to a point where we can say this is endemic like flu. But we are excited that we are seeing a decrease in these numbers right now. And so, we have to keep at it. And one of the things I really want to focus on right now is our pediatric vaccinations. So let's get started with the next slide, where I want to start with the data around pediatric cases, which really gives us information on the scope of the situation. So here you can see, right after Thanksgiving, we started to see a surge in pediatric cases, and that our sequencing at the time really showed us that that was a Delta surge. And then you can see right around the time of Christmas, just a dramatic increase, a sharp increase in COVID among all pediatric age groups. And this is our Omicron surge. Currently in our state, the 5 to 17-year-old age group has the highest case rates in the state. And none of this really is entirely surprising if you look at the vaccination rates for these age groups and incorporate what we know about the spread of Omicron. But it does reinforce how important it is to get our children vaccinated. So let's dig into this a little bit. As of January 22nd, you'll see that the vaccination rates for kids ages 5 to 11 is about 27%, meaning 27% of kids 5 to 11 have received just one dose of a COVID vaccine. And that compares to 70% overall for the state of Delaware. Now, one might think that that isn't bad since they've only been eligible for vaccination since November 2nd, but Delaware does rank 21st. Delaware ranks 21st out of all states in its vaccination rates to 5 to 11-year-olds receiving one dose. And about 20% in this age group are fully vaccinated. So given these low vaccination rates in this age group, as Omicron began to sweep the state, it's not a surprise that infection wasn't easy to stop in this age group. Well, you will also see on this slide is we see some differences, racial and ethnic disparities for single dose vaccination in this age group. So while 23% of white children in this age group have received one dose of the vaccine, only 15% of Black and 15% of Hispanic children in this age group have received one dose of the vaccine. Now, if you look at the 12 to 17-year-old population who've been eligible since May for the vaccine, 62% have received at least one dose, and almost 55% have received two doses, but only 8% have received a booster. And this whole age group, for the most part, is eligible for their booster at this point. Once again, Delaware's 21st among states for the 12 to 17-year-old vaccination. So while vaccination rates are higher among this 12 to 17-year-old population, because their immunity from completing the primary series is starting to wane for those who were on target in getting their vaccine late spring, early summer, it's very important to get this age group boosted as soon as they've passed that 5-month mark. Also, as you can see, among the 12 to 17-year-olds, the percentage of Black youth in this age group is lower than the percentage of white youth who've received one dose of the vaccine. However, the percentage of the Latino group is, the Latino youth is substantially higher among this age group. I wanted to take a look geographically at how we're doing among these pediatric age groups. So on this slide right here, it shows which zip codes have a low vaccination rate in the 5 to 11-year-old population. So the zip codes in blue have a vaccination rate that is more than 10 percentage points lower than the state average for this age group. So you can see that Newcastle County is faring best for vaccination among this age group, with the exception of zip codes 19801 and 19802. However, some of our greatest concerns in our state for this age group is in Kent County and Western Sussex, as is reflected by the shaded blue zip codes. And if you look on the next slide, we're looking at the 12 to 17-year-old age group here. And again, this age group has had access to the vaccine since May, and the overall state rate is 62%. There's still a lot of room for improvements. And although not identical, we do see a very similar geographic pattern with lower rates in zip codes 19801 and 19802, as well as Kent and Western Sussex County. These data help us all as a state and in our communities to know where extra efforts are needed to help protect our children the most. So we know that some of the barriers for parents in getting their children vaccinated is concerns around safety. So I just wanted to share a little bit of information, more recent information. First of all, now at this point, more than 20 million children between the ages of 5 to 17 have received at least one dose of the vaccine. And the safety profile has just been very good, very positive for the Pfizer vaccine among these age groups. So here's what you need to know. Serious side effects have been extremely rare. And although that there has been some concern about myocarditis, it's extremely rare in both the 5 to 11-year-old population, as well as the 12 to 17-year-old population. And all cases, for the most part, were very mild and self-limiting. And in fact, the data show that in looking more closely at the 12 to 17-year-old population, that the risk of myocarditis from COVID infection, from getting the infection itself, is much more likely than the risk of myocarditis from vaccination. We know a lot of parents are concerned about possible developmental side effects, which there's no evidence of developmental side effects with these vaccines. We also know one of the myths out there that's been perpetuated is that the vaccine can cause reproductive or fertility issues. And I really want to reassure you that no reproductive side effects or fertility issues have been seen. The vaccination is supported by professional healthcare associations like the American Academy of Pediatrics, who say that reproductive side effects from vaccination are extremely unlikely. And in fact, a new study that was just released last week showed no reproductive side effects from the vaccine, but also confirmed that there were reproductive side effects from COVID infection seen for males. And so once again, the infection itself is riskier for reproductive side effects than the vaccine. Also important to know, the vaccine can be given at the same time as other childhood vaccines. And one of the concerns we know that people have shared is that the vaccines were developed quickly, but they were not developed quickly. At this point, we're 2 years into COVID vaccine research, which was built on a vaccine that had previously been in development for 10 years prior for the SARS and the MERS viruses. And scientists have been working for many years to develop vaccines against viruses like the one that causes COVID-19. So the COVID-19 vaccine that's available for children has gone through the same approval process that's required for other vaccines, including our routine childhood vaccines. None of the clinical trial steps were skipped and no corners were cut when it comes to safety. So where can you get your vaccine for the child? There's lots of places to get it. And first of all, I really, as a pediatrician, want to emphasize the important role of your pediatric healthcare provider. If you are still not convinced about getting the vaccine for your child, please talk to your child's pediatrician. It has been shown that these conversations have really helped to address people's concerns. If you've made the decision to have your child vaccinated, you can schedule an appointment with your child's pediatrician for the vaccine. But there's also a number of other places in the state where you can get your child vaccinated as well, like our DPH sites and pharmacies. No appointments are needed at the DPH standing vaccine sites that are listed here or at our DPH clinics. And additionally, Nemours and many pharmacies, including independent pharmacies, are vaccinating children. Those sites may require an appointment, however, so it's important to check beforehand. I want to just spend a minute talking about the booster and a new study that was released this past week looking at vaccination status and serious consequences of COVID in the time of Omicron. And according to the CDC, among adults ages 50 to 64, unvaccinated individuals were 44 times more likely to be hospitalized than their fully vaccinated peers who had also gotten a booster dose. 44 times more likely to be hospitalized if you are unvaccinated compared to if you've received a booster. That's a really astonishing figure. So where to get your boosters, or who should get your boosters? First of all, we encourage everyone who's age 12 and older and eligible to get your booster. And right now, for the most part, most individuals who are 12 and older are likely to be eligible for their booster. If it has been 5 months since they have received their second dose of either Pfizer or Moderna, you're eligible for a booster. If it's been 2 months since you have received your single dose of Johnson & Johnson, you're eligible for a booster. So we realized from some new polling that a lot of folks, especially younger adults and adolescents, those 12 and up, don't realize that not only are they eligible for, but that they should get a booster. We want to make sure that we get the word out there that for the most part, most people 12 and older at this point are eligible for a booster. So again, where do you get it? First of all, visiting de.gov/getmyvaccine or vaccine.gov can help you find a location near you. Here's a great service. If you don't have a computer, text "Get Vax" or in Spanish, "Vacuna," and you'll get 3 vaccine sites near you on your phone in just minutes. The best thing you can do to protect your children from the virus is to get them vaccinated, and for all of us to get a booster as soon as we are eligible, which for most people is now. So thank you, and back to you, Governor.
Thank you very much, Dr. Rattay. So make sure you get vaccinated. The most important thing that you can do, de.gov/getmyvaccine or vaccines.gov. I do want to go back to where I misspoke earlier about getting your tests at Delaware libraries. I meant to say that you can get on the website from Delaware libraries. So at covidtest.gov, you can log in there from home or at Delaware libraries and to order up that free COVID-19 test coming to us from the federal government, courtesy of President Biden. So it's covidtest.gov from home or at your libraries. You can't get the test at the libraries, as I said just a few minutes ago. So let's get that squared away. And with that, AJ, thanks for everything that you and your team are doing.
No, thank you, sir. And I'll just add on to that library point. They've been a great conduit for individuals that may not have internet access. So whether you go there to order it or maybe even make an appointment for one of the other sites, it's a great resource to have in your community. I'm going to talk about testing a little bit today. I think the governor opened up and talked to us how we saw a little decline in our testing rates last week, but still kind of at that upper threshold that we've seen over the last 18 months. Last week we did 53,000, down from 62,000 the week prior. We saw a substantial difference in the number of openings that were available, 48 and 72 hours prior to our appointments for those sites that did require them. We saw the DMV site in Delaware City work very well. Again, we're able to do about 1,000 people there a day. Saturday, Sunday, we were doing mid 300. So opportunity there. We are going to keep that open through this Sunday, and then we're going to sunset it. Can't thank our federal partners enough for the assistance and really flexibility they provided us in bringing an additional resource into the state. Moving on to the hospitalizations, the governor talked about where we are today for the COVID, the individuals that are still waiting for tests, and then the additional individuals in the hospital. If you see that blue slant or that blue graph is having a quick downward trend, which is great, gives our hospitals a little bit of time to relax. However, the overall census is still high. So the COVID cases are going down. Hospitals remain busy. Overall, they still aren't doing elective surgeries across the board. So, it just shows you the amount of stress that's out there in the hospital systems. It's not crystal clear when we'll be able to pull out the National Guard. It is going to be something we talk to them about over the next several months. Going into the National Guard, I think, we've had some great success over the last really 2 years with the National Guard, and it's specifically just over the last 2 weeks. We put 74 or 77 CNAs into long-term care facilities between yesterday and today. We have another just under 10 that will be hopefully making their ways into the facilities over the next week or so. That's going to help us bring this number down right here. So the goal is we put those nursing assistants in the nursing homes that are having some staffing challenges or outbreaks, and that's going to help us open up beds to help decompress the hospitals. The ripple down effect, the snowball effect of that is now we're able to, people are able to get their elective surgeries. The care that's been postponed for, the last several months or over the last year and a half is now able to get attended to. Next slide, please. But again, the National Guard have been doing tremendous work. Just going to share, the numbers again. 77 certified nursing assistants that have passed the program already, in the nursing homes as of this morning. We have 170 National Guard members in every hospital across the state providing assistance. Here we have Staff Sergeant Craig re-enlisting at St. Francis, I think the 20th. I think that was Thursday or Friday of last week. Did a quick ceremony there, and it was great to have the leadership from the hospital there as well. But it just shows you how these Guard members are, a pillar of our community. On top of this, and unfortunately we don't have a picture of it, but Specialist Thorne from West Africa received his United States citizenship last week as well while he was on orders in the hospital. He's been a member of the Delaware National Guard for 3 years, and just finalized the citizen process. So we call them your citizen soldiers. Our neighbors, they're there for us, and they're there right now for your healthcare community to make sure we get through this latest peak and we could all recover healthy. So, but that's where I'm going to turn it back over to you.
So last thing there is keep yourself and your loved ones safe. Get your COVID-19 booster. Overwhelmingly, your odds of staying healthy and out of the emergency room, out of the hospitals, if you get your booster. So if you haven't been boosted yet, and we need to pick up those numbers, we have good vaccination numbers pretty much across the board. Do still need to get those young adults 18 to 35 vaccinated. Those are where the vaccination rates are the lowest, and need some focus, as Dr. Rattay said, on our young people, those eligible, the younger ones, so 5 years and older up to age 18. So get those vaccinations and get tested if you need to. We still have those testing resources out there. The demand is starting to slack off as our numbers get better. Everything's headed in the right direction, but as Dr. Rattay accurately pointed out, the numbers are still extremely high. You're about 1,600 positive cases each day, compared to the summertime where it's 100 or fewer. We're talking now 550 hospitalizations. In the summer, at our best days, it was 14. The peak last year was 474 on the same day. So the numbers are getting better, but we're still not out of it yet. Keep your mask on. That compliance has been really good. I'm really excited and proud of folks all across our state and really stepping up to take that really positive act. And so with that, and our thanks to the Army and Air National Guards, men and women, for everything they're doing, really to bolster our healthcare workers in the hospitals and doing a tremendous job, and in our long-term care facilities. Thank you very much. And we have media with us today, and we're here for any questions that you might have.
All right, Governor, the first question is going to come from Meredith from the News Journal.
Hi there. I have a question regarding pediatric vaccinations. Does the state feel limited in the strategies it can use to get more kids vaccinated? Is there going to come a certain point where other incentives or possibly some type of mandate is used to get more vaccinations up down the road?
Dr. Rattay, any thoughts there?
Yeah, we're really focused on education around the vaccine. We know that access it should not be a problem at this point because there are a lot of access points for vaccination, but we know that there remain a lot of concerns from parents about the safety of the vaccine, which was really driving, much of my desire to talk about it today. We know these vaccines are safe, and it's important that we continue to convey that. But I think what is most important and what will make the biggest difference is if people are hearing that from individuals in their community that they know and that they trust, like their pediatricians, but also other credible resources in the community. We think that that's what can make the biggest difference.
Our next question will come from Andrew Sharp of Delaware Independent.
Hi, yes. Does the state differentiate between people who are in the hospital for something else and incidentally test positive for COVID and people who are in the hospital for COVID?
Yeah, Andrew, that's actually been a big question through this most recent surge. And it kind of was brought to our attention as we watch the data every day, and we try to use the data to make various decisions and understand what's happening out in the world, so to speak. And one of the things that I noticed several weeks ago, I guess as the surge started to hit us, was a disconnect between the increase in the number of people hospitalized that have tested positive for COVID and the number that are admitted, which is another data point on our website with COVID. And there was a kind of a disconnect. And so we started asking questions about that. And your point is accurate, where you have some people who are admitted because they've tested positive or they have those symptoms and they test positive, they need to be treated for COVID or COVID symptoms, and other people who are admitted for something else and then subsequently test positive. And so for COVID or with COVID has been a question that we didn't ask last year, really, but became more relevant this year. I'm not sure it makes a difference to how we react. The hospitals still have those patients, and we still have to have been put in a position to support them. They have patients that are patients or workers, hospital workers that can't come to work because they test positive. And so the effect is the same. It does give a different context to what's actually happening there. Dr. Rattay, any other thoughts about that?
Yeah, just to add on to what you have said, Governor, and we hear from the hospitals is two things. One, from a resource perspective, it's still very intensive from a resource perspective for the hospitals. They still have to place COVID positive patients in a separate unit, requires extra PPE, extra staffing. So it is more resource intensive whether you're admitted with the diagnosis for COVID, if COVID is the cause of your admission or not. Still resource intensive. But the other thing that's very important, whether you're admitted for surgery, whether you're admitted for a heart attack, a stroke, another reason, having COVID certainly complicates the course of your illness, regardless of whether or not that is why you were admitted. So it is a factor, but we know that certainly, many people are found to have COVID while they were admitted for something else.
Our next question will be from Jacob Owens of the Delaware Business Times.
Yes, good afternoon, Governor. Just two quick things. Last week, one of the things you announced was a call for volunteers to come help the hospital workforces. I'm just curious if there's any anecdotal results of that, if we've actually seen folks come back to help out.
Yeah, the response was really very positive, and I'll attribute it to the videos that accompanied our press conference with the emergency room physicians talking about the situations there. But I'll let Dr. Tay and AJ respond too, but I think I've heard that over 600 responded. That's a big number by any calculation, and some couldn't work full time, but just the idea of, I want to help. I've got some experience. I want to help. Just, it had to be heartwarming for the hospitals to see that kind of response. Dr. Rattay, AJ, any thoughts?
No, I think you covered it, sir. I mean, I know they've got a big response. Hospitals are, I won't say interviewing, but going through the list to see how they can utilize those people with their hours they've identified in their shifts, et cetera.
Our next question is going to come from Tim Mastro.
Hi all, good afternoon.
Hey,
Was
Tim.
just wondering if you could give a little bit more detail on the FEMA site. Was the demand there, even though we're kind of coming down from the peak of the surge, did it have the effect that you wanted? And do you foresee having something similar in the foreseeable future?
AJ?
So no, thank you, Tim. I think the demand was there. I think, if you look at the numbers, end of the year, first week of January, we were getting a lot of requests and feedback about not being able to get a timely appointment or appointment close to it. So this was a request. It doesn't happen overnight that was made and was able to stand this up. It was not taken full advantage of, which is good and bad, right? So the demand's gone away, but we still want to test people so they could, know what their status is. I would say at this time, I think from several initiatives, the community testing that Lisa Henry and her team continues to do around the state that's targeted, the availability of at-home tests now that are back in stores to some extent, that are being sent out by the federal government, to the clinics that are doing testing, to the rapid PCR capability that the state has. I think I've said for the last 2 years, it's a layered approach for testing. So I think people don't want the result 48 hours after they drive through. They want it 15 minutes, or they want it the next day. So I think, there's a lot of variables that go in this. We're going to sunset this at the end of this week. We continue to look at what's the most effective way to test in locations and the products we use, et cetera. And, we'll continue to discuss that with Dr. Tay's team as we move forward. But the demand has decreased. I mean, I think we have to make sure we utilize our resources correctly, and having only 350 people that go through a day, we could reallocate those individuals to other assignments that could hopefully help us better.
It does go to the question, though, of how you plan for these events, right? Do you, thinking about, I compare it to a flood. You don't engineer all your transportation infrastructure, all your storm culverts and your highways for the 100-year flood. But when you get hit with the 100-year flood, it kind of overruns the system. And similarly, when you have a surge, you can get overrun by, in terms of testing, vaccination. If you remember the demand for vaccination at the very beginning, when the supply wasn't there to meet that demand. And it's really hard, I think, to plan to link up supply and demand in an efficient way. And I think that'll be something we'll look at in a kind of after event type of fashion.
Our next question comes from DJ from WDEL.
Hi, I guess this question might be for Dr. Rattay, but if the current surge dies down and we head into the summer, things start to even out, how long is the booster supposed to last? And do you anticipate the state needing to do this all again next winter? Will we have to get more shots?
So it's a really great question. One where there's still, we don't have all the information yet. In looking at the boosters, I just saw a study today looking at the boosters 4 or 5 months out. They seem to be holding durability quite well. However, always multiple factors that we don't have all the answers to. We don't know what kind of genetic mutations or variability we'll see in the future going forward. And also, we still don't know exactly how long the booster is going to be protective for. I think a lot of experts are assuming that we'll probably need an annual booster. It may even be, along with the flu vaccine. And just like flu vaccine every year is modified based on what variants are in the community, it's very likely that we'll see the same with COVID going forward. So there's a lot of unknowns right now. I think the hope is, though, that at some point in the not too distant future, we are able to pivot to an annual vaccine, just like we see with influenza.
We're going to go back to Jake Owens, who has a follow-up question. Again, Jake from the Delaware Business Times.
Yeah, sorry. Just one more quick thing. Obviously, it's understandably early, but I'm wondering if there's any metrics or goals that the governor is looking to meet before he would consider repealing the latest public mask order.
Yeah, I get that question a lot, particularly from your readers, particularly from business owners. I mentioned earlier that I attended the quarterly meeting of the Restaurant Associations group, and that was the question that they asked. And my answer is simply not a day longer than we need it, right? The question is, how long is that? And, we look at all the data. We, at one time, you'll probably remember, because you've been very vigilant in tuning into our press conferences, particularly when we had them in the auditorium there at the Carville building. We look for the magic number, so to speak. We reimposed the mask mandate, first of all, this time because the voluntary mask mandate, the reliance on businesses to impose it themselves, didn't seem to be working. And we were getting hit with a really incredible surge in the hospitals. And so it was really because of that hospital surge and the need to do something better, a little more effective. My preference is always to do it voluntarily. Well, that when you get this long out, I guess, in this kind of a pandemic and people are tired, there's just not as vigilant. And so we had to go to that. So we'll continue to look at that hospital number and the conditions in the hospital. We have weekly calls with them. AJ and Dr. Rattay will be on, as will I, later this week, I believe, and get a better update on what the conditions in the emergency rooms are, what's their surge looking like, and then looking at the number of positive cases every day, the percent positive, the tests that we're doing. And then in the aggregate, now we do have a lot of experience now in terms of where things are going. Even if you look at our curve right now, peaked on the exact same day as it did last year, coincidentally, probably, and we're on the other side of that peak at the moment. Hopefully, permanently, pretty steep decline. We're helping decompress in those hospitals, but we know there's still a ton of spread, as Dr. Rattay said. So we'll meet together and talk about it within our team, and then make a decision. I expect that, or I know that the school mask mandate will continue just because we want to keep our kids in school. Teachers want them to be there. They know they have to be there. We know they have to be there so that people can go to work. So it's just such a incredibly important thing. But when you have so much spread, people are testing positive, teachers, hospital workers, all the rest, everything kind of falls apart a little bit. And so you really kind of have to look at all the data, get the reports back from our school superintendents, from our hospitals. We're just fortunate in Delaware that we can do that. We can get all your business chambers on the same call and hear their feedback. What I hear from them now is they're having trouble because they don't have people coming to work because they're positive with COVID. So I know that's not a very specific answer. I guess the answer is we're not going to look for a specific data point because I don't think we have that kind of certainty around what data point gets us to where we want to be. But we'll be looking at it as things change and as they improve, and make a determination as to whether or not we need the mandatory piece of that. People, we encourage people to voluntarily keep their masks on when they go inside a public place, your grocery store, your convenience store. I do it just out of respect for the employees who are in there, right? And for the businesses that employ those employees.
All right, Governor, we have one pre-submitted question, and this comes from Cody Decker of WRDE. Cody asks, Delaware Tech has put in a vaccine mandate effective May 1st for all visitors to the college, including students and staff and children. Is this something you support? And if so, why?
I think President Brainerd is doing what he thinks is necessary to protect his teachers, staff, students, to keep his campus safe. And I applaud him for taking that action. I think everybody whose responsibility it is for a business, an enterprise like Delaware Tech needs to make those decisions. That's kind of what I've been saying. They all know better than I how to run their operations. Obviously, at some point, we have to intervene when we're not getting the result that's in the public interest and that's in the interest of all Delawareans. And that's been our North Star throughout this, is what's the best thing for the health and safety and wellness of every Delawarean. And people with kind of very narrow focus don't have the big picture, don't understand that, or sometimes have trouble understanding that, I've got to do this, I've got to wear a mask indoors in order to protect, my neighbor, my grandmother, or from COVID-19 that could kill her, or that could put her in the hospital, and curtail their ability to provide necessary hospital services to somebody that doesn't have COVID-19, that has something else. And that's why we made decisions based on that. I know President Brainerd understands his campuses, the needs of his employees and his students better than most of us, and certainly better than I do. And so I applaud him for taking that action. And, we've been trying to Dr. Rattay responded to a question about getting the younger children vaccinated. There, clearly it's a very real necessary educational process to really help parents make the right decision, a decision based on science and not based on things that people read, online. So yeah, I applaud President Brainerd for taking that action and encourage all business owners and operators to do the same. We've made that same, a similar decision, not the same, but a similar decision for state employees and public spaces that are part of the state government.
That
So I
was
think
the
that
only
was the
pre-submitted. Yep, that was the
last
last one.
question. So thank you everyone for joining us. Thank you to AJ and Dr. Rattay and their teams for their continued good work. You can see up on your screen, if you haven't been boosted, get boosted. If you haven't been vaccinated, get vaccinated. Hang in there with us. You've been doing great with wearing masks indoors. I appreciate that. Think about the workers there and the businesses, because without those workers, they can't stay open. If it's your grocery store, your convenience store, whatever it might be. And importantly, with those of you with children, and make sure they have their masks as they go to school every day. We want them to stay in school. You know, I was in Harlan Elementary earlier today, and a lot of teachers and students in there, but they've struggled, as each school has, on and off, with teachers and staff being out with COVID-19, and I know that's it negatively affects the children. So the numbers are better. They're still, very seriously high at every level, every number of positive cases, number of hospitalizations, percent positive, or not as high as they've ever been, because they're down from the peak just a couple weeks ago. But if you go all the way back to last year, they're higher than the surge in last winter, but they're getting better, and that's the good news. They're getting better. The National Guard has arrived at our hospitals, at our long-term care facilities. Help has been on the way and now has arrived. They've been greeted with open arms, and I know they're going to do a great job. If you have a neighbor or a friend who's in the Guard, please thank them for their great work, and we look forward to seeing you next time.